So ladies and gentlemen, our next speaker is a very good friend to the center and a tremendous resource for healthcare. When people ask me what data we use at the Center for Connected Health and who we look to understand what's happening in the world of technology, we look to Susannah Fox and the data from the Pew Research Center. And so I think she needs no more introduction than that. Ladies and gentlemen, Susannah Fox.
Thank you so much. I am really honored to be here. One of the core themes of this conference is engagement. So today I brought new survey data about e-patients because the E in e-patients stands for engagement. But first I want to acknowledge the legacy of Tom Ferguson. He was, oh good, yes, thank you. Tom Ferguson was an MD who believed that he actually saved more people's lives by never practicing traditional medicine. He believed in the concept of self-care back in the 1960s and 70s, and he foresaw what the internet would become, and he coined the term e-patient. Tom was my mentor from the year that I met him in 2000 until he passed away in 2006, and I continue to learn from him as I review what he taught me. One of the most important things that Tom taught me was that life is a puzzle, and clinicians cannot try to put together the pieces of someone's life. Clinicians really should only intersect with someone's life puzzle when required, because all the pieces of our puzzle are really our own hopes and expectations about our lives. And medicine is just one part of that. What I'd love for us all to do today is actually think about your own puzzle. Think about the puzzle of your own life. What are the pieces of the puzzle that you know well, that are clear to you? What are the pieces of the puzzle that are indistinct or blurry that you would like to learn more about? I would argue that engagement and self-tracking is a way for us to learn more about the pieces of the puzzle that are indistinct. I want you also to think, though, about how a clinician might view the puzzle of your life. Do you show all of the pieces when you talk to a clinician, or do you keep some to yourself because they're too scary or too embarrassing to share with a clinician? I think that's really where we need to go in terms of understanding patients' lives, understanding what is the self-knowledge that we wish that we had about ourselves, and are we going to share that in clinical engagement? So these are the sorts of questions that the Pew Internet Project and the California Healthcare Foundation considered as we were designing the survey that we put into the field in August and September. And what I'm going to be talking about today is new survey data that I haven't published yet, so you guys are getting a sneak preview. And the reason for that is that I actually think our field is moving too fast to wait for publication. There is a place for evidence-based medicine and peer review, but there's also a place for moving a little bit more quickly and understanding where the field is going. Now, looking at my own life's puzzle and thinking about my own engagement in healthcare and self-tracking, I have to say I wouldn't ever describe myself as a self-tracker. I don't own a Fitbit. I don't own a Zio. I run, but I don't track my mileage or my pace. I don't even own a scale. And instead, what I rely on is a time-honored way of self-tracking, and that is I have a pair of skinny jeans. And I'd actually love to see a show of hands. Who has a pair of skinny jeans in the audience? Right. So you guys are actually self-trackers. But then I realized that in this case, I represent what internet people sometimes call the normals, the normal people, the vast majority, the people who really aren't that into this stuff. Unlike all of us who probably have 2, 3, or even 4 devices that are connected to the internet, possibly here with you today. So I set out to take some measurements of these people who are the opposite of the early adopters. We asked questions about self-tracking. We first asked whether someone tracks their weight, diet, or exercise routine. And by the way, these questions were asked of all adults, and it was not necessarily asked about, it was asked in the context in general, not in terms of internet use. We found that 60% of American adults say yes, they track their weight, diet, or exercise routine. 1 in 3 track other health indicators or symptoms. And in the survey question, we listed blood pressure, blood sugar, headaches, or sleep patterns. And we also had a set of questions in the survey which attempted to measure the caregiver population. And as most of you know, caregivers are the front lines of healthcare. Our questions were based on a federal series. We included both people who are caring for an older adult, as well as a spouse or a child who's facing serious conditions. And we asked caregivers, do you track a health indicator or symptom? 1 in 3 say yes. Now, I have to tell you, I really had no idea what we were going to find out when we put that survey in the field. And after the first night of interviews, I actually listened to the audio of all the calls that were made the night before. And 2 things happened. One is, I got so excited that I actually had to stand up to listen to the rest of them because everybody was answering yes to the self-tracking questions, and I didn't expect that. The other thing that happened is that, luckily, on the very first night, we happened to call someone who's living with diabetes. And she said, listening to our questions, you really don't have a way for me to express to you how I use my device. And so we actually changed the question and were able to basically, again, learn from an e-patient about how we need to change the survey question. And we were able to respond to that. Now, you might say, this sounds amazing. 7 in 10 American adults are self-trackers. That can't be true. Well, here's the truth. Half say they're tracking in their heads. So these are my people. These are the skinny jeans trackers. We just need to respect who they are and what they're doing and what they understand self-tracking to be. 1 in 3 say they use a notebook or a journal to keep track of their weight, diet, or exercise routine, or the health indicator that they're tracking for themselves or for a loved one. 1 in 5 use technology. And that actually matches some data that we collected in 2010 when we found that 1 in 5 are using the internet to self-track. Again, you might be surprised by this, or you might not be. This is the reality of people's lives. Half of the self-trackers in general say they track on a regular basis, and half say they track just when something comes up in their life. Maybe it's a series of migraines and they want to figure out why it's happening. The question that I have for you is, how are you going to create tools and interventions that are as seamless and as easy as keeping track in your head, or even as easy as just writing it down on paper? That's the challenge that you have in terms of creating technologies that acknowledge and respect where people are today. In our health surveys, we also ask people if they're currently living with a chronic condition. And so I took a look at the group that is probably most in need of self-tracking, who could really benefit from self-tracking. And that's the group that has 2 or more chronic conditions. 62% of adults living with 2 or more chronic conditions say they track a health indicator or symptom. This is the kind of data that you can use to map the frontier of health and technology. And you'll hear me use that metaphor a lot in terms of mapping the frontier and looking at the landscape, because I describe myself as an internet geologist. I believe that you need to know the history of the land that you live on. You need to be sure that you're building your house on bedrock and not on sand. Don't bet on things that are fleeting. Follow people where they're already walking. Lay down paths to track what they're doing and maybe try to slightly redirect them. So, where are the paths online? Well, one just went off actually in the audience. How many people can touch their mobile phone right now? They know exactly where it is. 85% of American adults has a cell phone, or as I like to call mine, a tracker. This has potential in terms of people who are not yet using their cell phone for health. And we collected some data about that. 1 in 5 smartphone owners has a health app. And the most popular categories are about what you'd expect if you just took a look at the iTunes App Store. Exercise and fitness, diet and food, and weight. Now, I saw this data, and I actually decided to call up the CEO of Weight Watchers, David Kirchhoff, and talk to him about what we found and see if he had insights to share, especially around the topic of engagement. You might know that Weight Watchers has a very successful app right now. They've had 10 million downloads of their app. And what he talked about is that as a company, they have actually been waiting for the moment when they could find an app and find an application that would integrate with their website and with their in-person support groups, because they really felt like an app just standing alone was not going to be enough. And because what they've seen is that engagement is what really makes the difference in their members' lives. And so I thought that was an important insight to think about. The secret of the success of this particular app and this intervention is the engagement. It's the integration with the offline program. So let's pause for a moment and think about this again. We have this big group of people in the United States who are living with conditions which could probably benefit from self-tracking. The data is in that you can better manage weight loss, high blood pressure, diabetes, a host of conditions if you are willing to do the self-tracking. We also have a significant group of the population, 7 out of 10 American adults, who are doing self-tracking to a certain degree. Yes, they might be doing it in a way that you wish that they would engage more, but there it is. We do have an overlap. And we also have a huge group of people who own a device and keep it near them that has potential for turning them into more engaged self-trackers. But we're still at this stage where only 1 in 5 are really engaging with the technology that a lot of people in this room wish that people would engage with. So what's our goal? Is our goal 100% participation for the people who are living with 2 or more chronic conditions? I would argue now that you have this data, you can set forth your goals. What do we want to do with patient engagement? Now that we know what the parameters are, what are you going to do about it? Now, I should say that there were some interesting outliers in the survey. When we asked people, it was just an open-ended question, what kind of health apps do you have on your phone? There's a small group of men who have a menstrual cycle tracking app on their phone. Now, you might wonder, why would a man be checking a menstrual cycle app? Well, I think a lot of people might be able to guess a few reasons, but I'm just going to talk about one, and that is fertility. That if you are trying to make a baby, you need to maybe not be out of town on the day that here comes the egg. And so this is just one of those applications that I thought, yes, let's look at the majority. Let's look at the majority of what people are doing and how people are using their cell phones. And the Pew Internet Project has a lot of data about that. But let's also look at the pioneers and learn from people who are really on the frontier. Now, this is just for the ladies. Have you ever gone into to see your OBGYN and not immediately been able to tell them the date of the first day of your last period? They are exasperated with you. They are so mad. I confess that one time it happened to me and I just made it up. I couldn't remember. And now this is some self-tracking that all of us as women are expected to do. And you know, so everybody has their ways of doing it. Again, how can we use that? And the other thing that I wanted to talk about is the sharing that happens. You know, in that case, you're expected as a woman to do that self-tracking and share it with a clinician. And so we included this question about sharing in the survey. 2/3 of self-trackers say they do not share the data that they collect with anyone. 1/3 say yes, they do. And we did ask the question, who do you share it with? Half say that they share it with a clinician. Half say they share it with family, a friend, or a member of a group. This is an example of an amazing visualization of Katie McCurdy's medical timeline, which she created because she was having some mysterious symptoms that she wanted to track. And she happens to be a visual artist and a designer. So she created a beautiful medical timeline and wrote a blog post about it, which you can read on epatients.net. And she did it for herself, but she also did it so that she could tell her story better to her clinician. I did also want to talk for a moment about a blog post that I read this week. There's somebody who tweets as texting my pancreas. And she wrote a blog post about the burden of her diabetes management and the information that she manages. She wrote, as patients, it's not enough that we have to live with the disease itself. We have to live with the data management as well. What are you doing to create a tool to help her? What are you doing to help create a tool like Katie McCurdy's timeline? What are you doing to help someone like me recognize that maybe I could do more with self-tracking? I think that's where engagement really could go. Now, a question that came up when we were looking at this data about how, frankly, how few people were sharing this data with clinicians. What does that say about clinical engagement with data? Are doctors and nurses maintaining essentially a don't ask, don't tell policy? If they knew how many people were self-tracking, would they begin to ask their patients? And who are those patients who are showing and telling the data? These are the research questions that I'd really like to explore, and would love to hear if there are more research projects who are doing that. Now, speaking of sharing, I just wanted to go back to what I started with, which is all of us here have this puzzle of life that we're trying to put together. Think about what are the aspects of your life that you share when you visit a clinician, and what are the aspects that you still keep secret, that you don't share, and how does that affect the care that you receive? One of the first lessons that I learned from Tom Ferguson was that I could never really know the full story of someone's life. And that the most important thing that I could do as a researcher who's trying to understand how people use the internet and the social impact of the internet is to spend more time listening, less time just asking. And that's what's led me to do so much of my fieldwork in online patient communities. Tom drove this lesson home by recommending a book by Diana Forsyth called Studying Those Who Study Us. In one chapter, she describes how in the 1990s she did fieldwork in an artificial intelligence lab. And the lab got an assignment to create an information kiosk for newly diagnosed migraine patients. The idea was that a migraine patient would walk into the hospital or a doctor's office and see this kiosk and ask some questions, maybe before their appointment. Now this sounds quaint, of course, in the internet age, because of course you just ask those questions on your mobile. But again, it was the 90s, so in some ways it was ahead of its time. So the lab created the kiosk, and it was a failure. Patients were polite, as they often are when they're evaluating a tool that's meant to help them. But they found out that it wasn't answering the #1 question among people newly diagnosed with migraine. Am I going to die from this? That seems like a silly question to a neurologist. But it's a secret question that those migraine patients had never felt comfortable asking their clinician, but they would ask that blank box on the screen. What had happened is that the artificial intelligence lab had interviewed one doctor about what he thought patients would want to know, instead of asking patients what they wanted to know. And the mismatch was complete. The research team simply assumed that what patients wanted to know about migraine was what neurologists want to explain. That doesn't work. It doesn't work in research, and it doesn't work in trying to create interventions that respect patients and reach them where they are. So, how many of us have asked Dr. Google a secret question? I know I have. And the intimacy of that blank search box is multiplied when you have it on your mobile phone. What I invite you to do is think about how you can use that in your work. Think about how you can take the data that I've described and make sure that your project is a success. Make sure that you are laying down paths online where people are already walking, so that you can reach people where they are and possibly deviate them a little bit more towards health. As Diana Forsyth taught us, there's so much potential for impact if we can design for what could be. Now, I'm going to close with the data that I, again, had no idea what we were going to find. And I'd love to hear your interpretation of these findings. 34% of self-trackers say their data collection has affected a health decision. 40% say it's led them to ask a doctor new questions or seek a second opinion. 46% of self-trackers say that it's changed their overall approach to health. Now, again, this is just our baseline. This is where we are in 2012. Where would you like to see that go in the next year, in the next 5 years, in the next 10 years? What are the trends that we're starting to see today that are going to have an effect on these numbers? And what are you going to do to help people put together the puzzle pieces of their lives? How are you going to use this in your own life? How are you going to create tools to help people? Thank you very much.